And welcome back. While nearly 9 in 10 young children have had a dental visit in 2019, challenges persist with over 30% of high school students missing routine care and nearly 60% of New York City adults at a heightened risk for oral health problems. These statistics underscore the urgent need to address the disparities, particularly among minority communities, and to enhance dental education as part of a comprehensive healthcare strategy. Joining me now to discuss this is the dental director at La Casa de Salud and Acacia Network, Dr. Michelle Witter. And Dr. Witter, thank you so much for joining us.
Thank you for having me.
Yeah, it's an important conversation to have. I mean, when you talk about preventive dental care, a lot of people are taking advantage of it, and then yet and still we are seeing a lot of people not.
Very true. It is something that I encourage all people of all ages to come to the dentist and receive preventative care because preventative care is essential for improving your overall health.
And we normally see, like in underserved communities and economically disadvantaged communities, a lack of coming to the dentist because whether it could be health, dental insurance, it could be just family, family commitments and time. Talk to us about what we're seeing in the underserved communities and how you're really imploring people to get on out there.
You're absolutely right. Time is everyone's enemy, and it is critical that people see the importance and the necessity of making time for their oral health. What we have done with our services at La Casa de Salud is we try and serve everyone. So we start at the age of 3 and up, all the way through geriatric ages, in order to allow families to come together and maybe not take so much time off where in which only one person gets served. And we try and treat the whole family during one appointment so that we maximize everyone's time. Also, we are also teaming up with social services and other nonprofits within our community and within our own Acacia network in order to maximize our contact with patients who are really under-resourced or having no access to care.
Yeah. We talk about children, and they're really the primary topic of conversation these days. The fact that they've got to get in there, got to have that preventive care. From your perspective, the importance of preventive care as a child.
For children to have preventative care, it's critical because it helps set the stage for the adult teeth to come into their mouth in their teenage years. So what we are trying to do is save space for the new adult teeth to come in and allow children to have a smile where they feel confident to go out into the world and express themselves and not have to worry about that one extra layer, especially in such a big social media age that we live in now, where the smile means everything. That could be one like or one dislike in social media, as well as allowing them such access. Social media is a great tool in such where they have access to all this information. So we are trying to develop a network of links within our own websites and within our own new social media platforms to inform our patients, especially children, so that they have the basics available to them to understand how to floss their teeth, which type of sugary beverages to avoid, what things can prevent cavities, which also are known formally as dental caries, and how you can floss and how you can brush, and which soda would be better versus which juice. So we're trying to look at it from different avenues in order to make sure that we talk to our patients, talk to our parents to increase the oral literacy for what it takes to prevent cavities and preserve your dentition for the future.
Yeah. Well, Dr. Witter, I know growing up, my parents were very big on this. You got to make sure you brush your teeth. And we
Yes.
always stayed away from that C word, the cavity, right? I mean, I was good. Growing up, actually, as a child, didn't have to worry about it. And I think, so far to date, I haven't had one. But the reality is a lot of people, that's not the case. For whatever reason, we're seeing an increase in cavities across America. Talk to us about this increase and what are your thoughts on why we're seeing it?
I think the type of nutrition that we are receiving has changed since I was a child, or maybe when you were a child as well. And I think that we, as much as we're trying to be healthier with the things that we do consume, sometimes the different chemistry of these products fight the flora of our mouths, the bacteria that's supposed to be there. And sometimes our neglect from being distracted also plays a role into why we may not be taking care of our teeth as well as we could. However, I think there's so many tools out there now for children and adults to help maintain their dentition that it's really about making that contact or that first meetup. That's why for us it's important by the age of 3 for us to have our children start having that conversation, even if it's just a walkthrough and a meet and greet so they can get familiar with our services, get familiar with what it's like to sit in a dental chair. We just want to make dentistry less scary. And sometimes starting from a younger age can also influence a parent to want to come and be part of our care and to restore their smiles. It's just really important for our children to understand that yes, we are targeting them. Yes, you have parents for the young teenagers who will say, yes, you have to go to the dentist. But as you get older, there's no one telling you it's time to go to the dentist. You have to take responsibility for your oral health. And part of my job is to reach the populations where I'm seeing less adults or less teenagers come in because they have other responsibilities, but they have to put a priority on their oral health.
Yeah. We hear a lot of talk about brushing. We know brushing is utterly important, but a word, if you will, on the importance of flossing.
Yes. So there's been a plethora of new ways on how to floss. People are just using a water pick just to force the bacteria or the food particles that have wedged between their teeth out. I will take anything. I just need you to start a routine of trying to floss. But flossing is critical because it helps get into the nooks and crannies that sometimes when our thumbs hug our teeth, our toothbrush just cannot get to. I am also a big believer in any type of automatic toothbrush because as humans, we just can't brush as many times as a mechanical brush can do for us within the time frame in which we brush.
Yeah. I want to take a look at some numbers here. And, a 2023 report by NYC Health highlighted a couple of things. Number one, good news, New York City children's preventive dental cares increased in the most completed decade from 2009 to 2019. Now, the bad news, 30% of high school students did not visit a dentist in 2019. Your thoughts?
Again, there's a lot of pressure on these children to do so many things now. I like look at the children's resumes for when they go into college. I don't think I could get into college anymore based on how much activities they have to go to. However, I think because there's such a reach into our audiences where they can receive information about oral education, it's important for us to increase the oral health literacy of the populations that we serve in order for them to take away this negative trend and bring us back to a positive trend in oral health. As we get past the pandemic as well, I'm pretty positive that we're going to see a increase in the number of preventative dental visits. But that taboo of not coming to see the dentist during the pandemic, I think really scared a lot of people away from the dental office, and now people are slowly coming back in.
And you emphasis on the key word slowly. And as you say, slowly, some are coming, some are not. The operative question. Yeah.
True.
And I guess the question that needs to be asked is how often should a person actually be going to dental visits?
Twice a year. If I can see you twice a year, I think that's a great way to start off. And then after that, if we need to see you more frequently, we will make recommendations to do so. And if a patient doesn't have teeth, at least once a year so that we can check the health of the bone and the gum tissue that support everything that they're doing, even if they're wearing dentures, to check to make sure that they're clean, that the gums are healthy, etc.
Yeah. What are we seeing by way of oral health problems? Are we seeing an increase? In oral health problems since we've come out of COVID? A lot of people stayed home.
Yes, I think a lot of people were grazing at home while they had access to all the beautiful things they may have in their refrigerator and their cabinets. And so there was an increase in the number of dental caries that was prevalent throughout the statistics of 2022 and 2023's New York City health publications. However, I think now that we're getting out again and there's less time to graze, we're eating more functional times versus just grazing throughout the day, allowing our mouth to recover and have the right pH level, which contributes to whether or not our mouth is going to be under attack by bacteria to cause more cavities.
Yeah. I understand over the last year you've had over 460 patients, over 1,300 dental appointments. Before we go, tell me about some of the common trends that you've been finding, Dr. Witter.
I have seen more cavities that are not baby cavities anymore. The cavities are severe where there's a risk for tooth loss and there's more inflammation and swelling in the tissue because of a patient putting off their dental care for fear of coming to the dentist or for the fact that they have to prioritize something else over coming to the dentist. So what we have tried to do here at Acacia within the Casa de Salud's dental program is try to block time so a patient doesn't lose too much time from their job and not just do one filling. We try and treat one whole area of the mouth so that when they leave, they feel like they had a significant amount of work done, and it kind of builds their confidence. We want to build people's confidence to return to the dentist, be our best marketers, and use word of mouth to bring everyone back to La Casa de Salud's dental programs.
Yeah. Dr. Michelle Witter, got to leave it there. Thank you so much for joining us and sharing a little bit about dental care and being preventive. I feel really good. I'm going next month. I already got my appointment. This is before this segment even was booked, so I'm on the right track. I'm gonna try to keep it going.
Wonderful.
Thank you. Dr. Michelle Witter, Dental Director at La Casa de Salud and the Acacia Network. Now, if you do want more information, visit the website at theacacianetwork.org. Also visit them on social media at Acacia Network. Encouraging you, don't go anywhere. We've got more open coming up right after this.